Right. Too many people are throwing money away when they have a Medicare Advantage plan, Medicare supplement plan, prescription drug plan. And that's what we're going to talk about today. Sarah is here from Chapter Medicare. She is a member advocate team leader on their member success team. So when you sign up for Chapter, that's one of the reasons we partnered up with them is they don't just help you sign up and find the best plan for you, but they don't forget about you the other 365 days of the year. And Sarah is one of those people you call to make sure the company takes care of you and make sure everything goes correctly. So how you doing, Sarah?
I'm doing pretty well. How are you?
I'm doing great. Thank you for joining. I appreciate it.
Of course. Happy to be here.
All right. So we usually have Ari on here from Chapter, and he talks about enrolling and stuff, and that's one part of the process. When you have a Medicare Advantage, you need to check that plan every year. But there is another 364 days of the year, and Sarah and her team is in charge of that. So basically, what it is here's what we're doing today. You paid for all of this, all of your Medicare, all those decades you paid those FICA taxes. Part of it includes Social Security, and the other part includes Medicare. So you paid for all this for decades and decades and decades. And then you pay the $185 Part B premium, or we don't know what's going to be next year. And then taxes as well. You pay taxes. And so that's how all this is funded. So when you get a Medicare Advantage, Medicare Supplement, Part D plan, whatever the case may be, you've paid for it. So these companies, they're not giving anything for free. You paid for it. So it's important that you get every single dollar back. It's kind of like you bought a brand new Corvette and you send the company the money for the brand new Corvette, and then you go there and they give you a Ford Focus. You're not going to be very happy. So let's make sure you get what you paid for. And that's what Sarah's going to do. Okay. So one of the big deals is with Medicare Advantage, particularly prior authorizations. So what type of things are you seeing with prior authorizations? How do you help people navigate that nightmare? And what are prior authorizations for those that don't know yet?
Yeah. So a prior authorization, there's kind of two different ways to look at that. One for like your prescriptions, and then another for certain medical services. Some medical services will require that. What we see a lot on the member advocate side of things are for medications. So a lot of you guys know about like the GLP-1s out there, like Ozempic, Mounjaro, Zepbound. Those medications require a prior authorization. And what that means is your doctor intervenes and tells the insurance company why you need to have that medication. Now, there's Medicare has like criteria in place to get those authorizations approved, but our team helps out with really informing your doctor's office and letting them know that this needs to be submitted on your behalf. We also contact your pharmacy. Sometimes pharmacies will start that process for you as well. And if they need any additional paperwork, sometimes insurance companies have very specific paperwork that has to be filled out. So we have those resources and we provide those to pharmacies, your providers, and then help you get that back to the insurance company.
Okay. So that seems like a big one nowadays, GLP-1. Everybody's trying to get that, but it's still limited to specific conditions, right? In terms of
Correct.
coverage.
Yes.
So does it look like they're loosening up those requirements, or it's pretty standard right now?
It's pretty standard right now. Like, we haven't heard anything about any less restrictions on getting those approved. Right now, the big condition that people get it approved for is for type 2 diabetes.
Yeah. And a lot of people are getting that approved. And it's the prices are going up or going down on those?
So a lot of the plans have a co-insurance for that, so it's a pretty fat amount initially. Um,
Right.
Next year, not entirely sure on what those costs are going to look like based on those plans. Seeing the trajectory of things, would not be surprised if those costs do go up a
Okay.
few percent.
Yeah. The reason I'm asking is, they was a couple of years ago, the Part B premium went up quite a bit, and they did
Mm,
that in anticipation of a new Alzheimer's drug that came out that they thought was going to be crazy expensive. So they really increased Part B, but then they turned out it wasn't very much, and so the following year they didn't increase it that much. So we're still trying to figure out what it's going to be for next year Part B. I've seen things where it's talking about $206 a month for
mm.
Part B. Yeah, but that's not y'all don't have any inside scoop. That's not definitive, right?
That's correct. That's not definitive. We'll probably know that October 1st. That's usually
Okay.
when they release that info.
Yeah, yeah, and the cola comes out in the first week and stuff. So yeah, the first
Mhm.
week in October, and I'll do some videos. So if you're, make sure you subscribe and like and share and all that kind of stuff, and I'll do a video on the new Part B premium cola, obviously, and then all the changes when Social Security comes out with the annual earnings limits and substantial gainful activity. I'll do videos on all those. So okay, all right. So prior authorizations. I always tell everybody that the key with prior authorizations is fight, 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 right?
Correct. Yes.
Right.
Yeah.
Yes. Yes. So always fight it, because these health insurance companies, I hate to break the news to people, but they're in it for a profit, and the
Mhm.
less they pay out, it's better for their bottom line. But if you really need it and your doctor thinks you need it, please, please, please fight it. All right. So, what are some of the other things? What kind of things do you see nowadays that people really need help with? You've got any interesting stories that people call up and say, "Hey, I need help with this," and any trends or anything?
It's it's always a little something different every day. Um, Lately, though, we've had a lot of people having issues with getting doctor's appointments in at a decent time. Some people are having to wait anywhere from 3 months, 6 months to even a year before they
Oh
can
my
even
gosh.
see. Yeah, it's really, really bad, especially in, like, certain states like California, or Texas. But we have actually been looking into new systems out there that can help us find newer doctors that are newer to practices that are more available for appointments. So it makes it easy for us to see which insurance plans that they take and how soon they're able to get signed up for an appointment. And then we schedule that appointment right then and there
Oh
using those
wow.
systems. So
Wow.
yeah.
Wait a second. We are not in Canada, are we? That's always the criticism of Canada. Yeah, they've got a great system, but you have to wait forever for appointments and stuff like that. Wait a second.
Mhm.
We have to do that here in the United States too?
Yeah, we get a lot of calls about that. A lot of people have problems finding doctors, and some doctors have limits on how many people they can accept that are on Medicare or on certain insurance plans, and it's really not fair to the
No.
population of people, on Medicare.
Okay, so you okay, wow. Okay, this is good. So if you're having a problem with your doctors, and wherever it is, just can't get an appointment, you've got a system to where you can say, okay, you're looking for this type of doctor, and you're able to find someone that might have availability, and you schedule it for them as well.
We do.
Oh wow. Okay. Well, that's pretty awesome. I
It is
like
very
that.
cool.
Wow. Okay. All right. So good deal. So again, anybody that's signed up with Chapter, you've got that service available. That's a pretty awesome service. So those are doctors that are accepted by that plan, but just might not. They're new to the particular plan, accepting that plan, and so you never know. They don't have the visibility, I guess, right?
It's possible that they may have moved from a different state and are like establishing a new practice in a different area. But yeah, this helps them get visibility on new patients, and then I mean it also helps us too to be able to help get people the care that they need. Very
Perfect.
helpful as well with plans who that require referrals. That's a whole nother that's a whole nother thing that we do help out our people
Yes.
with.
So how do you help people out with the referrals?
Yeah, so I have a really great example for you. There was a fella that was new to Medicare and he signed up on an HMO plan. Never really had like a ton of experience with an HMO plan, and generally these HMO plans are going to require referrals to see specialists. And he was going through blood cancer treatments. So he was consistently seeing a hematologist every couple weeks for testing and treatment. So we had to get him into a primary care doctor ASAP because these treatments are things that can't wait. And it was sad because like his hematologist canceled appointments beforehand because of the insurance change. So we found a primary care doctor and we were able to get him an appointment within a week and get him back on his treatments in a
Awesome. Good
decent amount of
deal.
time.
Good deal.
Yeah.
Good deal. Good deal. So what is the difference? A lot of people don't know that new to it. The difference between an HMO and a PPO.
Yeah, the most simplest way to explain the difference between that is PPOs are not going to require referrals to see a specialist. So you're able to go in or out of the network with the plan. So you have a little bit more openness with who you're able to see as long as they're willing to bill, out of network to the plan. And then HMOs require referrals. So you're really stuck with a network of doctors.
And we're seeing a lot of, and the PPOs usually cost more because you're going outside the network, and these
Mm.
doctors and clinics and hospitals don't have contracts necessarily with that particular health insurance company. So, and those contracts usually mean those doctors, hospitals, clinics get paid less, and the company saves more money. And so, yeah, so the PPOs usually cost more, correct?
Yes, they
Cost the company
generally
more.
Yeah, they generally have higher like copay costs, higher co-insurance amounts, and higher, max out of pockets.
Yeah, so it costs the company more, so therefore it costs you more. And what we've already seen, I talked about yesterday, is that some of these major companies are just canceling PPO plans. I think one is canceling. It's over 600,000 members that have PPO plans because they're, as Ari says, they are looking at margins. They're in their expansion phase where they want more and more people to join,
Hmm.
or they want to make more money. And 2026, they're in the we want to make more money phase, right?
Oh yes.
All right. So this is an even more important year to make sure you get every dollar possible back out of the system that you paid into, because these billion-dollar companies are definitely going to be trying to get every dollar they can out of you.
Oh yeah.
Um, here's
The
a
funny comment.
question
Sorry, the
from Chloe.
HMO is like a HOA. That's funny. That's very true.
Oh, really? Oh, that's right. Yeah, like an HOA.
Yeah,
Yeah, that's right.
that's funny.
Yeah, yeah. It's like cut your grass. I'm getting ready to turn 65 and keep getting cards in the mail inviting me in and a guest to dinner for a talk on Medicare. I know they're going to try and sell us something. What is the catch? It sounds like she already knows the catch. They're going to try to sell you something.
Exactly.
Yeah, that's pretty much it. But yeah, if you're already set up or you're gonna set up an appointment with chapter, or you've already got someone that's gonna help you out with that, or you're good, like you have a
Yep.
Medicare, supplement plan and you don't have to worry about it, then go down there and get a free dinner. So
Could get a free dinner. I will say, like someone who is actually legitimate in talks about Medicare aren't going to offer dinner either.
th-
So
there you go.
yeah.
There you go. That's the trick right there. Um, Yeah, because they're not supposed to be doing that. Anything tied is, I think, some places out there, because if it's like a sales type thing, they definitely can't do it. They might say it's kind of an education about other stuff, and so there's going to be some sneaky people.
Oh
They're not
yes.
supposed to be contacting you, calling you. If you don't call, whatever Medicare insurance agent or company, if you didn't call them, they're not supposed to call you. And because Medicare, the regulations are really, really stringent. I always tell the story of, when you walk into, Walmart or something, there's someone has a little table set up there. It says, ask me about Medicare. And they just sit there and they stare at the ceiling. And salespeople out there and like, oh, this person's a terrible salesperson. They need to get up and shake hands and say hello. They can't. They can't until you actually say, oh, what about Medicare? And then their eyes will light up and they'll say, yeah, yeah. And they'll talk to you about Medicare. But until you actually ask them about Medicare, they can't talk to you about anything like that. So yeah, Medicare regulations are crazy, crazy, which is
Oh
good, which
yes.
is good. Yes, very, very good.
Yeah, read the
Uh,
small print.
yes,
With
yes,
yeah.
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 Yeah, that is very suspicious that they're going to be doing giving out free food. They're not supposed to be doing that.
Yeah.
So there's that. All right. There were supposed to be letters coming out mid-year. I was telling everybody at the beginning of the year, yeah, you're going to get a letter this year, probably around June or July. And it's going to say, hey, you've got, our Medicare plan. And we just want to let you know that you still have dental and vision and gym membership and, transportation and all that kind of stuff. And, make sure you use it or you're going to lose it December 31st. And somehow, somewhere, I don't want to get conspiratorial, but yeah, those letters, they've put a pause on those letters. But you got Sarah and I. So Sarah and I are gonna serve as those letters. So what type of stuff? So all of the dental and vision, all that stuff disappears December 31st, right?
Right. Yeah. If you don't use it, you lose it, essentially.
So how can they find out what their Medicare plans have that they can take advantage of?
Yeah. So one way, you can call chapter. We're able to see the resources and information on the plans that you have. We can tell you what like your benefit allowances are. We can tell you who you can go to. So like if there's a certain dentist you want to see or a certain vision provider that you want to see, that's something that we can help you navigate. We can also check and see. There's really great resources for you guys as well online, like through your like let's say you have an Aetna Medicare Advantage plan, you can check like your Aetna portal or your Aetna app, and it should be able to tell you how much of your benefit allowance that you have left, whether it be for dental or vision or your over the counter. So,
Okay, perfect. And in terms of all of that, they all disappeared December 31st if you have a Medicare Advantage. So if you don't use it December 31st, then you're like, oh, I still got, $2,000 of dental and I'm too busy this year. I'll just go ahead and do it January, February. Then you're probably going to lose out that, right?
yeah, absolutely. And last year going into this year, United Healthcare made a really big change with a lot of their plans. So people that did have those dental benefits, the plan for next year didn't. You have to purchase a $52 monthly rider in order to get, additional dental benefits. So very, very important to check on, what it is that you have access to. And then, after October 1st, we'll be able to see what next year might look like for your plan for next year.
And that's one of the tricks I always tell people, particularly like in dental, if say for instance, if the dentist says, okay, you need, this much of work and it's cost $4,000 and you've got $2,000 on your plan available. Dentists know this as well. They say, well, let's go ahead and, schedule it for November, December. We'll do the bottom parts and cover that. And then hopefully your company also it does $2,000 next year as well. And then in January, February, we'll reschedule to do the top part and stuff. So you can kind of break it up over into 2 years once it kind of that money reloads, right?
Yes, a lot of people do that.
Yeah.
Yeah.
So that is a good way to do it. Someone, I like my Ford Focus. I knew I was going to get stoned. I, I always use the Pinto, but I got harassed by the Pinto aficionados club. So yeah, so I've gone away from the Ford Pinto. Okay, so what type of one of the things we always try to focus on our channel is fraud, waste, and abuse, because it does exist out there. And unfortunately, Elon Musk and Doge found zero in Social Security because they were looking at all the wrong places. But there is
Mhm.
fraud, waste, and abuse in Social Security and Medicare and stuff. And how all of that is found, it's always us, our communities out there saying, "Hey, this is strange." Upcoding. What is upcoding?
What is upcoding?
Yeah, when companies, the health insurance companies, say, "Hey, you went into the doctor for this," and the health insurance company pays the doctor maybe $100, but they change it to a upcode a little bit so they can get more money. Have you seen that happen?
We catch that very frequently. We do.
So what type of stuff are we looking at there? And so this is essentially Are these doctors' offices, clinics, hospitals doing these upcoding? And I think there was a big scandal. There's some lawsuits about health insurance companies doing upcoding themselves.
Hmm.
And because all of this costs us more money.
Yes.
And with all of the cuts in Medicaid, and there are going to be cuts in Medicare too, we need to make sure we save every penny we can and stop this fraud. Any other than upcoding, anything else out there that you see that are kind of suspicious people need to watch out for?
Yes. In particular, there's a form that doctors, like when you are, new to an office or maybe you're having a procedure done, there's loads of paperwork that they kind of push on you to sign. One of those documents is called an advanced beneficiary notice, where it says, "Hey, if this isn't covered by insurance, you're responsible for the cost of this procedure." So making sure again that you're reading the fine print, you're reading every piece of documentation that you're receiving from the doctor's office, because there have been plenty of times where we've run into claim issues or billing issues with our members and they had no idea that this document was signed, and now they're responsible for costs that their doctor should have sent either a prior authorization for or gotten the correct coding from the insurance company for. So
Uh, And usually those, particularly if you have help from y'all, those are usually figured out. But unfortunately, the members, the people are getting kind of caught in between. You've got the doctor's office that says, "Hey, we don't care who pays us, but we just need to get paid." You've
mhm,
got health insurance companies that say, "Well, they forgot to check this box or that box," or whatever the case may be, and so both both places just keep sending you bills and saying, "You need to pay this. You need to pay this," and you're like, "No, I'm not. I shouldn't be in between this. You should be talking to each other, right?"
right. Sometimes our advocates have to do that. Sometimes we have to connect the provider's office and the insurance company when there are billing issues like this. But that, again, that's like the great part about working with Chapter. And I'm not just saying that because I work for Chapter, but my mother's on Medicare as well. So this is a service that I think everybody on Medicare should have. But like our advocates are really good about catching these kinds of things and fighting these kinds of things with either the insurance company or the provider's office.
Yeah, that's one of the biggest things that my son and I were looking for a place out there because everybody was saying, "Okay, hey, Ed, you help with Social Security, retirement, disability, survivor benefits, all that kind of stuff. Medicare Part A and Part B, but there's other parts of Medicare as well." And I'm like, "Yeah, those are private
Mhm.
companies. I don't want to deal with those." But so many people are having problems and getting ripped off and incorrect information. So my son and I looked out throughout the country and we tried to find a place that is going to not only sign people up and help them enroll in the best plan, which is fine because people throughout the country that can help. You've got a niece or a nephew or old high school friend that can do that. That's beautiful. But it's the after service. It's after that that's the issue. I'm not going to say anything bad about the people in your community that help you sign up for Medicare, but they often don't know about all the stuff that comes after. Or if they do, they just don't have the time. They don't have a special team, dedicated to helping people after because they're doing it by themselves individually. They sign you up, and that's what they have to do. Is they just have to keep looking for people to sign up, and that's how they pay their mortgage and whatever the case may be. So they don't have a lot of time, and people are kind of left out there blowing in the wind, and don't get that help, and they have to. Sorry, whoever it was, Abby. They'll have to depend on that Ford Focus instead of what they actually paid for, right? All right, let's see. Jack says, I'm 64, turning 65 in August, ready to select Medicare. August 26th, you got a lot of time, Jack. Yeah, I wouldn't even probably mess with anything for now because, the new plans for next year, obviously don't come out till October. When is the first opportunity to go on Medicare? So, yeah, when you turn 65, if you're currently receiving Social Security benefits, then they will sign you up for Part A and Part B automatically. So about 100 days or so before you turn 65, you'll get your Medicare Part A and Part B in the mail, that card. If you're not currently receiving Social Security benefits, then you actually, and you want Part A or Part A and Part B, then you have to contact Social Security and get all signed up. But And from now until then, I would just try to figure out, what you want to do. There's two ways you can go. You can go a Medicare supplement plan, which is the ones I always recommend checking out first, like a Plan N or a Plan G, or a Medicare Advantage plan. For so check out the differences and see what's best for you, for your budget, your health and needs, and all the rest of it. Do you most of the calls you get, Sarah, are from people with Medicare Advantage and prescription drug? Do you get many calls from people with Medicare supplement plans?
We do the whole spectrum of coverage we get calls about.
Oh, okay. So, but
Mhm.
Medicare supplement's pretty easy, right? It's if Medicare paid for it, then
You'd be surprised at the issues that we run into on that side of things too. They're not as complicated, and by complicated, I mean there's not as much insurance company intervention as there is, on Medicare Advantage plans. But I would say this is probably where we run into the most coding, like billing coding issues with doctors' offices, especially when people are new to Medicare and they're going to their first doctor wellness visit appointment.
right.
Um, that gets miscoded so often.
Ah,
So
oh, okay. So it's not an issue with the Medicare supplement plan. It's itself. It's just in terms of the coding of it. All right. So
yeah.
when people get, because once you go to the doctor or hospital or whatever, people get those bill. Well, I wouldn't say it's a bill. That's how is this a bill? And they see something from the doctor, and they open it up, and is this a bill? And all they look at is the very very bottom. You don't know anything. We're just kind of giving you information. And then, it says, $3 billion charged,
Yeah.
but you owe nothing. And they're like, oh, okay, that's all I care about. I don't care about the $3 billion. And
Hmm.
they just throw it away. They just file it away. And file 13, the circular file called garbage. Um, but I know Sarah is with me on this one. Please take a few minutes and check it out. Maybe that's well to have someone on your team, you or someone on your team, a couple of people. We might have to do that. Another a video in the future where we show a typical bill like that, and maybe
Hmm.
we can point out a few different places where people can, that are red flags that people need to contact and say, hey, this is incorrect. It looks like you guys are, running a scam, or we'll be more nicer. You made a mistake. You made
Yeah.
an honest mistake. um, and that's going to save everybody a lot of money, right?
Yeah. So if you have something from Medicare that says that a claim was denied and whatever you had done was medically necessary, like that's something we should look into.
Perfect. Perfect. Zippy, I called ARP today. I asked what they're doing about Social Security cuts coming in Medicaid. I also told them to contact you. Hope they will. Okay. All right. I certainly hope they do. Bella, one of our regulars here, awesome. Chapter is a free service. It's very helpful with your healthcare plans and needs. Check out Chapter. Oh, wow. Thank you. All right. So let's see here. Um, so what about prescriptions? That's going to be a big issue for, looking at your plans. Um, there, so you've got generics, you've got different versions, different tiers. I've seen if you've got the same exact prescription and it's in a tablet versus a gel versus whatever, it's just crazy different prices. What
Yeah.
kind of stuff do people need to look out for their Part D plan?
So whether or not something is a capsule or tablet is important. Also, anything that is instant release or like extended release. So metformin is one of those. It's a generic drug, but they have a special version where it's not really covered as well on some prescription drug plans. Um, I know there's the manufacturer discount program that's starting out as well in 2026 for, like Xarelto, Januvia, Eliquis, medications like that, where in turn it's supposed to help lower those costs as well. But um, does that answer what you're asking
Yeah.
there?
So Yeah, there was the change of the prescription drug plan, which made the
Mhm.
biggest changes. So if y'all watched me last year around this time, I was saying 2025 is going to be one of the biggest changes for, Medicare plans for a long, long time because of that prescription drug. They switched it from, was it $8,000 max out of pocket to $2,000. So
Yeah.
health insurance companies were like, well, we can't make money on these people, so we're going to have to change it for everybody else. And it was a humongous change for 2025, humongous change.
Mhm.
Um, but I don't want to sound like a broken record. Yeah. What's that meme? Hold my beer. 2026 is going to be even worse, because we've already seen, companies are going back to their margins. They're being sued. And so someone has to pay for those lawyers. And I guess it's going to be the consumer. And, the fact that Medicaid is going to be cut by close to $1 trillion, and other, hospitals and places are going to want to find other places to cover that, because hospitals, if you get sick or injured or something like that and you go to emergency room and you don't have health care, the emergency room, they have to take care of you, and they get stuck with a bill, and they're going to pass it on somewhere. And guess what? They're going to pass it on to the next person that walks in there with health insurance, and everybody's going to be charged more. So 2026 is going to be a crazy year, but we won't know all of the little details and exactly how health insurance companies start recuperating some of their money, their profits, until
Yeah.
October 1st. Do you see any trends yourself of what, other than PPOs and everything being canceled?
Yeah, as far as like Part D goes, what I see potentially happening is those co-insurance percentages will probably go up on drugs that are brand name, non-preferred brand names, or specialty tier drugs. So those are going to be like rheumatoid arthritis drugs that are tier 5, or certain cancer drugs. Like those percentages will probably go up. Max out of pocket will probably go up slightly, as well as the Part D deductible. I wouldn't be surprised if more plans put out higher deductibles or more deductibles. Um, and then I also wouldn't be surprised if formularies change. So formularies are just a list of drugs that an insurance company has agreed to cover. I wouldn't be surprised if they started to take certain drugs, off their formulary. So
Mm. And there are formulary exceptions. A lot of people don't know this, is that if you have a particular drug and the company that you have has that, but it's a generic version, you can actually request for a formulary exception, right?
that's correct.
Do y'all do that sometimes, help people out with that?
All the time.
Oh, really? Oh,
All
okay.
the time.
So
Yeah.
what is it, like people, they just, because how does it work in each, I forget the actual medical terminology they use, each type of drug that addresses a particular condition,
Mhm.
every company has to have one or two or three of that type of drug, offer that type of drug, right?
That's correct. That's two types of that drug.
Okay.
Mhm.
So, but I've had situations where people says, yes, the two companies, the two pharmaceutical companies that have those two drugs, those, whatever it is, the formulary part of it or whatever, it just doesn't agree with me. It makes me sick or nauseous or something like that. There's another one that's the same, that treats the same condition that I am used to, and I want that one.
Mhm.
So that is a formulary exception, right?
That's correct. Yeah. So if the one drug that they are taking is not covered by the plan, they can request the exception for it. They do want to know if there are other types of the same drug that you've taken. They do want to know that information. They want the doctor to pass on that information. So
Okay, perfect, perfect. Keep smiling. I reported to Medicare, not that it matters. No, it matters. We used to get people reporting stuff too when I ran Social Security, my Social Security office. We used to get people that called into Social Security all the time and said, "Hey, this person is doing this, that, and the other," and we investigated those. But unfortunately, privacy type stuff, we never told the people. Oh, we called them up. Oh yeah, we We did this, that, and the other, and all that. We're not allowed to say that. But yes, it does matter. It does matter. And, it sometimes the long arm of the law, it takes a long time. They use your bit of evidence and they've got other pieces of evidence and that helps. And then they put cases together. And then 2 or 3 years later, you open the newspaper. Well, if you surf on the internet, I don't know about you open the newspaper anymore, but anyway. And then you see this doctor or whoever is, the perp walk, being arrested and stuff or having to pay restitution. So it does help. Please, please, please. If you see something, say something. Unfortunately, for my particular experience, probably about half of the people that reported things to us was about people, receiving disability benefits and working. They just didn't understand that if you're receiving disability benefits from Social Security, you are actually able to work. There's a bunch of limitations. And, eventually if you keep working a whole bunch, then your benefits will be cut off. But so, yeah. All right. Tiering exceptions as well. So because there's different tiers, have you figured out any rhyme or reason on how these companies come up with these tiers, tier 1, tier 2, tier 3, generic and non-generic and branded and not branded and all that?
I feel like that's a mystery. Like how they decide what, medication goes on what tier. Yeah, that is a mystery for sure.
Yeah. Yeah. And you're like, wait a second, this costs how much, but that costs, yeah, and they
Yeah.
change those tiering and that's an important thing when you're doing your Medicare Advantage plan this year is the fact that the companies, one of the, they don't normally, historically, they don't change the monthly premium. Medicare Advantage, a lot of those are zero premium. It's another Medicare regulation is that I cannot say it is a free plan, which is good.
Mhm.
Not allowed to say that, so I didn't say that. Because it's not free. You paid for it. You just paid for it 20 years ago, 30 years ago, and you're paying for it in your $185 and your taxes. So you paid for it, but so it's zero to you right now. And so these Medicare Advantage plans, the stuff is on the surface. They'll say, oh, we might keep your same doctor. It'll be zero premium. So don't do anything. Just let it automatically renew for January 1st. And please, 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 please don't look under the hood. Because we replaced your, engine with something that's not too great. And some of the places that they kind of do is the tiering. And you can do an exception. Do y'all get a people requesting help to get a tiering exception where they say, hey, this is tier 3, but I just can't afford tier 3. Is there any way the health insurance company can make it a tier 2? Do y'all get a lot of those?
We don't get those as often as we do formulary exceptions. Maybe like a handful of times we've had the tiering exceptions. Those aren't as successful, I will say, as formulary exceptions are.
But as successful. So you're saying that sometimes it does work.
Sometimes it does work. There's a really, really cool process that I think most people don't take advantage of when insurance companies deny some sort of authorization. There's a really cool thing called an appeals process. And they expect that most people don't take that route. And everybody should absolutely take that route. We can help you with that
Yes.
too. We can help out with the
Yes.
appeals process.
And I think a lot of people, that was a kind of a loaded question there about tiering exception. I know a lot of people they just don't know about it. They don't know they can do that.
Very true.
Yeah, it's like, oh, I can't negotiate with $1 billion company on the price of this drug. Actually, you can, whether you'll be approved on it, but hey, it doesn't hurt to try, right?
Right.
And appeal and appeal, appeal. Just same thing with the Social Security Administration when you're, appealing a disability claim, Medicare prior authorization and stuff like that. They are hoping that you just give up. And unfortunately for them, our community here doesn't give up. We fight until we get, yes, what we paid for, right?
Yeah, we have some advocates who get our number blocked because we fight so hard. So
Oh, really? Really? Oh, you are on the do not call list with a major billion-dollar. Holy cow. All right. Wow. Wow, that's, interesting. How popular would you say the innovative Plan G is? Have you heard about this? It's I think one company, I think they've actually, so a Plan G is a Medicare supplement Plan G, and it's set up to where it's a lower price for the first couple of 3 years, and then they, raise the price a couple of 3 years later. So when people sign up at 65 and they're like, well, I'm young, I'm 65 years old, I don't want to pay a lot. And so they come up with this innovative Plan G, and I think they have it trademarked, that company. So that's the only company that can do that, that one company. Have you heard about this anywhere yet?
oh yeah. So different insurance companies call it different things. So like for example, Blue Cross companies will call it the extras, like the extra plan G. United Healthcare will call it wellness extras, where they'll have maybe some additional coverage for like vision or hearing coverage.
Yeah, because a Medicare supplement plan, they don't do dental, vision, or hearing. But I get people sometimes that says, "No, I got a Medicare supplement plan, and it did cover dentists." And it gives you discounts, right? It
Yeah,
doesn't cover dental like dental insurance, but since that company does have a network of dentists throughout the country, they say, hey, if you go ahead and use that, those dentists will give you 10 or 20% discount. So it's not really a dental plan, it's more of just a
a
extra
discount.
discount, right? Yeah,
Yeah,
exactly. Yeah, but the innovative plans, that innovative plans is specifically, you just the monthly premium is cheaper for the first year, 2 years, or 3 years. So, yeah, that should be interesting whether other people are going to copy that. Let's see here, Bella. I never have any issues getting doctors in Florida. Thankfully, 2026 could be different. The
you're a
changes are
lucky one.
coming. Yeah, yeah. Florida actually has historically some of the best Medicare Advantage plans, because I think there's a few elderly retired people in Florida last time I looked, right? So they have to be very, very competitive. So some of the best, again, historically, not sure what's going to happen in October, Medicare Advantage plans are there because there's some Medicare Advantage plans, that have max out of pocket, of $1,000, $2,000, $3,000 or so. But Florida, I've seen some like $600 or something. And so, do you help people with that? Because a lot of people don't understand, the max out of pocket, and does prescriptions count as that? And what do you help people kind of understand whether
Yeah.
the insurance company is treating them right?
Oh, absolutely. So there's basically like two different max out of pockets. Like there's the one for prescriptions, which is the 2000, and then whatever is set medically by the plan. So the way that we explain it is any sort of copays that are paid on a medical service or a doctor's visit, even lab work, that cost is going towards that max out of pocket for that calendar year.
And some people ask me about, they've got this, prescription discount thing, and that one that Mark Cuban does. So if people get prescriptions outside of their plan, prescription drug plan or Medicare Advantage plan, then that doesn't count as a part of the deductible, right?
That's correct. And it also doesn't count towards the max out of pocket either.
Right. So yeah, people should really just kind of do the calculations there. If that's the only drugs you have and you're going to save money on it, then probably go for it, right?
Right. Like if you're not expecting to, I think poor health is not expected. Like if a cancer diagnosis down the road is not something that's ever going to be expected, but we always, you know, recommend on the side of caution. Just in case something happens, it's good to have that coverage. And then, again, you have our team support if you need help getting something covered by your plan.
All right. Perfect. Time travel. Original Medicare has a large selection of doctors and hospitals, doesn't restrict you to a specific network, plus fewer restrictions on seeing specialists. No need for referrals or prior authorizations. Exactly. So, original Medicare Part A and Part B. But unless you have a whole bunch of money under your mattress, then you're going to need something else. And so, what time travel is talking about is original Medicare, keeping original Medicare, and then getting a Medicare supplement plan like a Plan G or a Plan N to cover all the gaps. Because when you sign up for a Medicare Advantage plan, you're kind of technically giving up original Medicare. And people say, okay, so if I sign up for a Medicare Advantage plan, I am giving up original Medicare Part A and Part B, and I'm going to get all my health care from the Medicare Advantage plan. So that means I can cancel my $185 Part B, right?
We do get that logic sometimes, which is not the logic you want to have.
Right. Well, you do, but it just doesn't work, right?
Right. It unfortunately does not work that way.
Yeah. Yes, unfortunately, yeah. You have to have Part A and Part B in order to get a Medicare supplement plan, in order to get a Medicare Advantage plan. You have to have both of those. So,
Correct.
and the but if you or someone you know are having a hard time paying that $185, then there are a couple of options out there. One is contacting your Medicaid office, Medi-Cal, Denali Care, whatever they call it in your particular state, your Medicaid, and applying for Medicaid. And there's a thing called the Medicare Savings Program, where if they approve you for Medicaid, the state will pay for that $185. So that is a crucial thing. And unfortunately, part of the big, beautiful bill, that's, yeah, we're keeping an eye on that. States are going to have a hard time dealing with that, even though that $185, that Medicare savings program, it's not taken out of theirs. That's a federally funded thing, but it's going to be, everything is going to be crazy next year. Do you help people that are on Medicaid with those? Because if you're on Medicaid and Medicare, then you have those. You can have one of the Medicare Advantage dual eligible plans, and
Hmm.
which has a whole bunch of other interesting facets to them. What type of help do you provide there?
Yeah. So kind of backtracking what you said, we actually, so unfortunately, we're not able to help fill out like a Medicaid application or a Medicare savings program application, but we do have resources for every single state available to our members. So if that is something that they think they might qualify for, we can provide applications for doing that. But yes, we assist our dual special needs members very similar in a very similar way like as any other member. We want to make sure that they're utilizing all the benefits that they have, because unfortunately this group of people are very prone to those bigger brokerages out there that just bait and switch and flip people's plans based on specific benefits. So we
Yeah.
really take into account holistically what these people need. So these people typically are going to need assistance with transportation. So our team can help out with reaching out to their transportation vendor on their plan and help schedule rides to their doctor's appointments or to the pharmacy if they need to pick up their meds. We
Oh,
can help out with where they can go for their over the counter benefit or for their grocery benefit. And we do help out some of our members with their utility payments, because some of the plans help out with like water bill, gas bill, internet bill. So we can help them get connected to the right people within the insurance company to make sure that they're using that benefit and helping their bills get paid.
wow. Good deal. Wow. Yeah, you mentioned something here. There's this is a good bad situation in the fact that next year a lot of those grocery cards, the over-the-counter drug cards, it looks like they're going to disappear for the most part. I mean, as they have been up until now, and that has been a kind of a major trick that these companies out there kind of dangle in front of people. They say, oh, you've got this grocery card, and that you can pay for groceries and your rent and electricity and stuff in your area. We'll sign you up for that, and it's $100, $200. They do exist. One of the bad things is, they advertise that, and it's only available in one zip code in your state, and so they get you on the hook there. But if there is one actually available in your area, they kind of trick you in there and say, hey, look at this $100, $200. Wouldn't that make your life so much easier and stuff? And you sign up for that. And then that's the only thing they're focused on, is signing you up and waving this $200 grocery card in front of you. And then you find out next time you go to your doctors don't take that.
Mhm.
You lost your home health care. You lost this just for $200. So you have to look at everything. And the good part, I guess the bad part is, because a lot of those grocery cards are kind of going away as they've been up until now, um, less people are going to get tricked. But the worst part is there's a lot of people that are going to lose those grocery cards for 2026, right?
Yeah, there's what I've read on was more restrictions on accessing that benefit. So what we'll probably see, and what we've seen carriers already start doing this year, is requiring the member to have a chronic condition in order to use the benefit. So I foresee more carriers doing that next year on the new
Yeah,
plans.
the regulation, the CMS regulation that allowed companies to provide those grocery cards to pretty much anybody, that expires December 31st. So they're not allowed to do that under that particular regulation. But there is an existing regulation that says, okay, if people have chronic conditions, as you say,
Mhm.
um, that they need, supplementary health, healthy food and stuff like that, then you can provide it to those people. So there's
Mhm.
going to be a lot less people those are offered to, and then you'll have to prove somehow. I haven't seen how that's going to be proven yet. That you do have one of the listed, chronic conditions. And remember, again, all of these companies are in it for a profit. The CEOs and the board of directors, they got to buy their new yacht for the French Riviera. They can't go there with that 200-foot yacht. They need a 300-foot yacht this year. So they need to make as much money as they possibly can. So if other companies aren't providing those $200 or $300 grocery cards, they're not either. So the reason those cards got so great is because competition. It's I don't want to get into a scene from Dr. Strangelove here, but they were just ramping it up more and more. Oh, you're doing $100, we'll do $150. Okay, you did $150, we'll do $200. And that was costing them money to get people to sign up. And now it's nobody can really do that unless they have chronic conditions. So I think they're all going to be kind of ramping it down. It's kind of like when the tobacco companies, they were spending all that money on advertising, and then the government said you can't advertise anymore, and they're like, oh great, awesome, nobody can advertise, so that's awesome. So but they we're the important thing is, starting October, the new plans are going to come out October 1st.
Mhm.
All the new Medicare Advantage Part D prescription drug plans are going to come out October 1st. That's the first time we're going to be able to see what's going on for 2026. You can't switch your plan until October 15th, but you have until December 7th. So from October 15th to December 7th, you can change your plan or review your plan. And Chapter has been great about that. They contact me and they say, oh yeah, we had a whole bunch of people contact us yesterday to change their plan and stuff, but they were all in the good plan. So it was a beautiful thing. So if you need to change your plan, Chapter will help you change your plan, and your new plan will begin January 1st. And then you will have the opportunity, if you have any issues next year, to call Sarah and her team and get all the help, right?
Absolutely. Just be on the lookout for annual notice of changes in your guys' emails or your mailboxes. That'll give you the most up-to-date information on what changes are coming to your plan. So,
Perfect, perfect. All right, let's. I've got a few more questions here, and let's see. All doctorate offices I made me sign was responsible for insurance didn't pay. Our doctor won't see us if they don't have that elected referral, so that never happened. Seems like Medicare plans take advantage. A pun, I guess. So they're making people sign that if your health insurance doesn't pay, then you have to pay, and if you don't sign it, then you can't go to the back. Pretty much sounds like.
yeah, we've run into doctors' offices that are like that as well.
Yeah. Let's see. Received an email from Cigna. They are changing name to Health Spring.
Hmm.
Okay. Yeah, so that doesn't necessarily mean they have changed your plan. They just changed, they'll send you a new card, and then with the new name on it. But your plan, unless you review whatever plan you have, it's going to expire December 31st, and you have to figure out whether you want to keep that. If you don't do anything, you're automatically re-enrolled in the same plan that you have. But those people, that close to 1 million people, are going to receive a denial, or not a cancellation notice. Those people with
Hmm.
the PPOs, so they're going to be canceled. And I always say, it's terrible being canceled, but in this case, people that get canceled might be very, very happy they got canceled, right? Because they have new
Yes.
options.
What a great opportunity to get into a Medicare supplement plan when you get those letters. So,
Right. Yeah, so make sure you keep that letter, because on the bottom of the letter it says you have a guaranteed issue. So if you're 80 years old and your health ain't that great, um, no problem. You've just been canceled. On the bottom of the letter it says you've got a guaranteed issue. So you can get a plan G or possibly a plan F, a guaranteed issue plan, and no health underwriting whatsoever. So
correct.
so most people don't want to be canceled, but there's a lot of people out there that says, please cancel me, please cancel me. So, all right. Oh, I already answered this question. You see any other questions that we need to address before we call it a day? A growing number of Americans are finding insufficient coverage options or jaw-dropping medical bills after unknowingly signing up for Medicare Advantage. Yeah, I agree. They don't read the fine print, because it's written in language, and max out of pocket and this and deductibles, and does this deductible count as the out of pocket, and what's this tiering thing, and yeah, it's the whole thing. I'm sure you could spend about an hour going through all the acronyms on all of this stuff. Um, what's the it's what Ari said, it's the three P's. It's your providers, your prescriptions, and your priorities. The number one is to make sure whatever plan you have has the providers you want to keep for the following year. That's the key. Let's see if we got any other. Physical. Does original Medicare cover a physical? Annual wellness visit is not an annual physical. Thank you, Jonah, for that. What exactly is the difference between those? Do you know any details about how they're dealing with those?
So when I mentioned that with like supplement plan people, this is the issue we run into the most with them, is that this is billed incorrectly by the doctor's offices all the time. So differences are, typically with a physical, you're going to get like your regular blood work done. That's not what happens with a wellness visit. It's more so just kind of like a general checkup. Blood work is billed differently through Medicare.
Okay. So yeah, a wellness check is not a physical. So yeah, and there's no free physicals. It's kind of a wellness check.
Yeah.
When an Advantage plan tells you what tiers your drugs are, will that tier be the same for all the different Advantage companies? Do they all do different tiers?
They do.
Yep. So yeah, and so that's another key. How much will I have to pay next year in 2026 if you have an expensive medication and that's your priority? Is okay, I want to keep this doctor, and okay, maybe a little bit flexible, but I definitely need to keep this prescription.
Hmm.
How much is it going to cost me? And so if that's your priority, then definitely that is your priority. So, all right. So I think we're at an hour, and thank you so much, Sheriff Sarah, for joining us. We sure do appreciate it. And hopefully we'll have you back over again once October starts. So you can give us an idea of how everything's going for 2026 and what people need to check out.
Absolutely. My pleasure. Thank you for
All right,
having
take
me.
care. All
You
right,
too.
thanks everybody, and have a great night. And as always, please, 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 please take care of each other.